Mr. Leon Pereira.
Mr. Speaker, I informed the Ministry of Finance office holders that Leon Pereira will not be speaking.
Ms. Irene Quay.
Mr. Speaker, sir, I thank the Minister for the progressive and strategic budget. For this debate, I would like to focus on healthcare budget. Rising healthcare costs and expenditure in the elderly are critical issues affecting our overall healthcare system and are highlighted in the recent budget speech by Minister Heng last week. As a healthcare professional working in the public sector for the last 20 years, I can see the transformational change in our healthcare system, especially in the last 8 years. From a previous healthcare system designed to tackle acute medical condition for a much younger population to new models of care and financial assistance schemes implemented to cater for the aging tsunami, we have seen many changes. I will highlight some I consider to be especially significant to acknowledge the hard work and foresightedness put in by the Ministry of Health and the various health and community partners. The introduction of CHAS to allow Singaporeans to enjoy subsidy at private GP and dental clinic for treatment and screening, the introduction of the Pioneer Generation Package and now the 6.1 billion Merdeka Generation Package, and the upcoming Elder Fund Scheme to support Singaporeans who are severely disabled. Substantial increase in subsidy offered to lower and middle income patients for long-term care services, specialist care and medication, MediShield Life and the new CareShield Life as universal healthcare insurance to ensure lifetime coverage and higher monthly payout. Expansion of aged care services such as home care services, elder care centers, nursing homes to cater for the needs of our aging population. Ramping up of healthcare facilities and infrastructure with at least one hospital built every 2 years, and strengthening of healthcare workers' numbers and capabilities. Implementing the MOH community network for senior schemes that link senior who lives alone with befrienders and volunteers and help them with social problems and early referral of complex needs to MOH. At this juncture, I would like to salute to MOH for taking on the nation's future health challenges, but at the same time, would like to share my grave concern for the escalating healthcare cost. Before I go on, I would like to declare my interest as the President of the Pharmaceutical Society of Singapore and the Assistant Director, Allied Health Office at KK Women's and Children's Hospital. Aon, an insurance survey group, quoted hospitalization, physician services, and clinical investigation as the top 3 leading causes of inflation for spending in healthcare. With the increasing burden of an aging population and the steep and continuous increase in the incidence of chronic diseases, coupled with increasing complexity in the management of chronic diseases, more can be done to promote team-based model of care. This model encourages healthcare professionals, doctors, pharmacists, nurses, allied health professionals to work in synergy to provide cost-effective but holistic care to achieve positive health outcomes. This is in line with Ministry of Health's Beyond 2020 Master Plan. We have to focus our resources to upskill and empower our allied health professionals and pharmacists in the community to take on greater roles to provide value-based care at a sustainable cost. In my current role, I see a huge potential for allied health professionals to be engaged in team-based collaborative practice framework, where practitioners can practice at the top of their license to be the first touch point for the management of certain physical, psychological, podiatry, or speech-related disorders. One example is this. Pediatric patients with only speech delay without other medical conditions are seen and evaluated by doctors in the polyclinic. However, they have to be seen by another doctor in KK before they can be referred to our speech therapy department. Under the current financial structure, patients will need to be evaluated by another doctor in KK before they can be accorded subsidized treatment. I'm concerned that this leads to additional consultation costs as well as delay in seeking proper speech intervention. Similar examples in adult restructured hospital as well as patients who need outpatient rehabilitation. So is it not possible to streamline the process not even for doctors who work within the same healthcare sectors or same healthcare cluster. Empowering allied health professionals as first contact point under the defined criterion of collaborative framework, coupled with the right financial subsidy structure, can free up our doctors to focus on more complex medical conditions. This will allow our healthcare system to extend their reach to a greater population and improve accessibility to appropriate care to a more financial sustainable manner. Overseas studies have demonstrated that patients with musculoskeletal conditions such as non-severe back or neck pain, as well as hand injuries, benefited from early access to physiotherapy and occupational therapy at the primary care or emergency department. Take, for example, in the Queensland health system in Australia, physiotherapists treating patients from the emergency department triage category 3, 4 and 5 with a range of agreed musculoskeletal presentation. These roles typically involve assessment, intervention, referral for further treatment and assessment, and discharge when appropriate. The Allied Health First Contact ED service has assisted the hospital and health services to meet their national emergency access targets. Another example involves the advancement of community pharmacists' role through the extension of government subsidy scheme for drugs, provision of vaccination to the public to bolster the national flu vaccination rates, as well as clinical pharmacy services such as medication review or reconciliation services in the community. This will in turn improve accessibility and affordability of medication in the community, enhance the provision of health information, improve health literacy in the community, and reduce overall healthcare expenditure. A 2017 systematic review published in the Journal of Epidemiology and Community Health looked at studies that calculated the return on investment for public health interventions. The researchers identified 52 studies that look at interventions at the local and national level. Health protection intervention, which include vaccination that match for the actual influenza type, has saved $34 for every $1 spent on them, according to the review. Hence, prevention is cheaper than cure. With the issues shared above, I hope that the following proposals can be considered to make our healthcare more efficient. Firstly, we can acknowledge the expertise of allied health professionals and pharmacists in the national subsidy framework, perhaps in the following ways. A first contact consultation service for allied health and pharmacy services in a community. A government subsidy scheme that encourages medication dispensing in community pharmacies. Incentivize community partners to work with pharmacists and allied health through collaborative prescribing and practices, and extension of CHAR scheme to allied health services in a community. This way, GP can refer CHAR's patients to private or VWO therapy clinics for allied health professionals follow-up management at a subsidized rate for a predefined conditions. We need a holistic system to keep patients in the community. Secondly, in line with the government strategy to support a skilled workforce, Minister Heng mentioned in his speech on the need to reskill and upskill our Singaporeans. One example I can relate is to provide training support to upskill our allied health professionals and pharmacists in the community settings, focusing on communication skills with geriatric patients and other health literacy skills. Thirdly, we have to empower allied health professionals and pharmacists in the community to take on greater roles in preventive care and health screening for chronic disease management through the collaboration with MOH, Health Promotion Board, and community healthcare partners, as this is one of the most effective ways to curb escalating healthcare costs. Residents screened under the CHARS program can also be referred to community pharmacists for continued follow-up and reinforcement of a healthy and active lifestyle. I hope that the above proposals can be considered and resources be allocated to support this new model of care through mainstream funding. These proposals will reduce inefficiencies and make our access and processes in healthcare leaner and reduce healthcare costs. As shared in Minister's budget speech, FY19 will run into a 3.5 billion deficit, largely due to the additional funding support for healthcare. For now, we have the FY18 surplus to draw on, but we need to remain prudent and constantly look for ways to remove waste in our healthcare system so as to ensure long-term sustainability. Notwithstanding the above, I stand to support the budget. Thank you.
Order. I propose to take a break now. I suspend the sitting and will take the chair at 3:55 p.m. Order. Order.